Thank you so much for joining us today for Teaching with Aquifer Integrated Illness Scripts, a quick start guide. My name is Megan Hotelling, and I'm the Community Engagement and Events Manager for Aquifer. We want to welcome you all and thank you for joining our webinar today, and welcome to our Aquifer curricular partners. A beta set of scripts are currently available to Aquifer curricular partners for the subscription year, and we are releasing more each quarter. We are excited to share with you more information about the integrated illness scripts and how you can incorporate them into your curriculum. So to give you an idea of what we will be spending our time doing together today, here's our agenda for the webinar. We'll be covering cognitive integration, what the integrated illness scripts are and how you can use them, and we will leave time at the end for a question and answer. If you have questions along the way, we encourage you to drop them into the Q&A panel. We will have a live Q&A at the end, and if you'd like, you can request to be promoted as a panelist to ask your question live on screen with our panelists. So you'll just use the raised hand feature for that. We also encourage discussion in the chat as well during the webinar, so feel free to utilize that. We're happy to have this opportunity to provide you with an overview of integrated illness scripts, an innovative new teaching and learning tool developed as part of the Aquifer Sciences Initiative. The initiative is a partnership between Aquifer and the International Association of Medical Science Educators, also known as IAMSE, to develop and disseminate teaching and learning tools that promote cognitive integration and collaboration of teaching of basic and clinical sciences in health professions education. Before we get started, let me give you an overview of what integrated illness scripts are for those of you who may not be familiar. Scripts are an evidence-based tool developed by experts specifically designed to promote cognitive integration in the minds of our learners. Our scripts are a framework or a mental model that links basic science and clinical knowledge by interweaving causal mechanisms and clinical features for conditions, providing a deeper understanding of why each condition occurs. So I'm pleased to introduce our presenters today, including Dr. Leslie Fall, Chief Executive Officer of Aquifer, Dr. Amy Wilson-Delphos of Case Western Reserve University School of Medicine, Dr. James Nixon of the University of Minnesota Medical School, Dr. Dave Harris of the University of Central Florida College of Medicine, and Dr. Kit No of Loma Linda University School of Medicine. Today, we are joined by Dr. Robin English from Louisiana State University School of Medicine in New Orleans and Dr. David Harris from the University of Central Florida College of Medicine as our panelists. And now I will turn it over to our presenters.
Thank you and welcome. I'm so glad to be here today. I'm Dr. Leslie Fall, CEO of Aquifer and the co-director of the Aquifer Sciences Initiative. I'd like to start out by sharing the purpose of our work. Our foundational goal is to educate students to make better, safer clinical decisions supported by sound biomedical reasoning. We believe that bringing together basic science and clinical knowledge in a deeply integrated way will help students to build the expertise they need to become more efficient learners and effective clinicians. Creating a deeper and more systematic understanding of causal mechanisms among clinical learners is an important step toward improving patient care and reducing harm as we drive to advance diagnostic accuracy and practice patient-centered, high-value care. All too often, inaccurate or delayed diagnoses, inappropriate testing, or ineffective or wrong medical management not only result in harm to individual patients, but impact the entire system. It is estimated that more than 12 million Americans experience some sort of diagnostic error each year, and 1 in 3 healthcare dollars are wasted, driven by unnecessary services, inefficient delivery of services, or missed prevention. The costs related to these problems are estimated to exceed $100 billion a year. For me, and I'm sure for many of you, this is not an abstract concept or distant headline, but a reflection of my own personal experience. My own journey into this work began over 20 years ago as both a pediatric hospitalist and a clerkship and residency program director, working side by side with medical students and residents. During rounds, I was becoming increasingly frustrated and at times alarmed by my trainees' inability to leverage and use the basic sciences they had clearly mastered in the pre-clerkship curriculum to make routine patient care decisions about diagnoses, workup, and management. This was especially apparent in my mission to reduce unnecessary testing and use of expensive and often empiric therapies. Many times I reflected that this lack of applied understanding could have led to serious patient harms. And sadly, on a few occasions, it did. Why are students and novice clinicians struggling to apply what they have learned in their basic science classes to new situations and in clinical setting? And it's not just my students. Why have I heard the same from so many of my colleagues across the country? It was here that my passion to solve this challenge was born. Unfortunately, many of us have likely seen our students struggle through the transition from basic science to clinical education. I see students that I know have learned these things. I know they have answered questions correctly on a test, but now, faced with a patient, they can't apply that information to what they are seeing in the patient in front of them. We have relied too heavily on our students to integrate what they have learned across a variety of basic science classes and to figure out for themselves how to apply this to novel clinical scenarios. Research has shown that this is an incredibly difficult thing for learners to do. Expert clinicians organize their knowledge of diseases into scripts, but our methods for teaching them how the human body works and where it goes wrong are siloed by discipline and disconnected from the reality of its application to patient care. Too infrequently do we focus on the integrated causal mechanisms that underpin the common diseases they care for. Although individual institutions and faculty are working in innovative ways to address this problem, few of these approaches effectively address integration at the learner level and in a manner that can be broadly applied. To take a deeper look at these issues, I'd like to turn it over now to Dr. Amy Wilson-Delfos.
Thank you, Leslie. To address this problem effectively, we need to focus more deeply on the mind of a developing clinician. Although there are several well-known curricular integration models at the program, course, or session level, they fail to address knowledge integration at the learner and evolving practitioner level. Cognitive integration of basic science and clinical medicine occurs in the minds of learners and is essential because it promotes effective packaging and organization of content, such that it can be used to provide safe and effective care for patients. This framework comes from the Cognition Before Curriculum paper, in which Kulasegaram and his colleagues from the Nicole Woods Group at the Wilson Center for Health Professions Education in Toronto argued convincingly that if we are going to effectively integrate the basic sciences and clinical experiences, we must focus on developing conceptual cognitive connections between these two different types of knowledge using learner-centered, content-focused, and session-level strategies rather than the more traditionally faculty-centered, curriculum-focused, program-level approach to achieve this objective. Cognitive integration matters because research has shown that effective cognitive integration improves diagnostic accuracy, particularly in novice clinicians. And that goes back to our central goal of improving clinical decision-making skills in our learners. The challenge for us as educators lies in translating this approach into effective teaching and learning strategies, methods and tools that may be effectively and broadly adopted. We believe some of the answers lie in findings from another key study. In this study, published around the same time as the cognitive integration paper, the Woods team at the Wilson Center asked dental students to learn about 4 conditions diagnosed by X-ray that are easily confused. Half of the students learned the conditions using the standard framework called segregated in this study, and the other half were taught using a more integrated approach. In the segregated approach group, a concise paragraph teaching the basic science mechanism for each condition was provided, followed immediately by a paragraph outlining the diagnostic, clinical, radiographic features of the condition. In the integrated approach, each condition was taught with the same basic science content underlined here in blue, integrated with the same clinical radiographic feature content, underlined here in orange, in a deeply integrated sentence by sentence fashion. The results are significant. In fact, the lowest performing student in the integrated group performed better than the highest performing student in the segregated group, both immediately and 1 week later. Let's pause to consider the clinical consequences of this study. Which group of students would you want assigned to your case if you were a patient? Or as a clinical educator, which group of students would you want to be taking care of your patients? Now, let's take a look at how we've translated these findings into the tools we've developed, the integrated illness scripts and mechanism of disease maps, to specifically address the challenge of teaching and learning in a cognitively integrated way. But before we do, let's step back to understand what a traditional illness script is and how it is foundational within the mind of a practicing clinician. To do this, I'd like to introduce Dr. James Nixon.
Thank you, Amy. An illness script is the term for the mental model by which a clinician stores and recalls relevant biomedical concepts and their relationship to clinical problems, such as diseases, conditions, or syndromes. Expert clinicians draw from a repertoire of scripts developed and honed through years of experience to drive purposeful clinical data gathering, to compare and contrast diagnostic hypotheses, and to direct initial management decisions. Said another way, an illness script is what a particular illness or condition looks like to a clinician based on their reading and their experience. Novice clinicians naturally begin the process of illness script development the moment they begin learning about diseases and conditions. Targeting these earliest learning experiences and then building upon them is the primary aim of our Aquifer Sciences initiative and its pedagogy. In the traditional model of an illness script, knowledge of each clinical condition is organized within a clinician's memory into three main components. The enabling condition, or who gets it. Is it older people, younger people, people with certain exposures? The fault, or what it is that's happening in these people that leads them to develop this condition. And then the clinical consequences, or what symptoms will they present with and over what time frame. Importantly, research demonstrates that how a clinician encapsulates relevant information within these components facilitates or hinders accurate and efficient information retrieval during clinical decision-making. As an example, here is an illness script for asthma organized in the traditional format. On the surface, this appears to be both succinct and nicely integrated, providing novice learners the relevant basic science details on asthma on the right, and then adding the more clinically relevant information on the left. However, separating the basic science and the clinical concepts still misses the mark. Leaving this information separate doesn't truly integrate the information or the lessons learned from research about how learners recall and transfer knowledge most efficiently. To achieve fully integrated structure, we applied the lessons learned from Baghdadi's team in Toronto to write truly comprehensive descriptions of the clinical features, pulling in each core concept that underpins the causal explanations, each highlighted in a different color here. It's at this level of integrated holistic understanding where effective, lifelong clinical problem-solving abilities truly begin. This is how information should be packed and encapsulated in the minds of a clinician, starting on day one of their education. And this is what is delivered in each clinical feature in each integrated illness script. And now to see our integrated illness scripts in action, I'll turn it back over to Amy.
Thank you, James. Now we're going to jump into Aqueduct, our teaching and learning platform, to take a look at the integrated illness scripts as you, your faculty colleagues, and your students will see them. So when we enter our learning platform, you'll notice right away the nice blue banner on your courses page for integrated illness scripts. As we click on the banner, you'll see all of the scripts currently available with our beta set. Additional scripts are in development to be released throughout the year as they are finalized. The first thing I'd like to do is take you inside a script and go through the anatomy. So let's take a look at asthma. Each of our scripts includes an overview, the epidemiology, up to 6 of the most common clinical features, implications for further workup and management, and the mechanism of disease. The overview begins with the definition of the illness, followed by the underlying pathophysiological insult and the environmental and epidemiologic factors that trigger the insult. We think of the insult as this body was functioning completely normally until X happened. Thus, this section provides a concise description of the basic science genesis of the disease that explains all of the mechanisms that follow. Our work has demonstrated just how important this understanding is to building a cognitively integrated clinical knowledge base. The epidemiology section dives deeper into the social, structural, epidemiologic, and personal risk factors that trigger the underlying insult and their underlying mechanisms, highlighting key pathology and genetics concepts. Our scripts have a deep focus on the science behind the epidemiologic factors, striving to ensure that racial and other biases that have no evidentiary foundation are not carried forward. The clinical features that follow articulate the most common presenting clinical findings for this condition at the time of diagnosis, a description of how that finding would be discovered by a clinician, and most importantly, each feature includes its own detailed description of the basic science, causal explanation for why this feature occurs in this condition. For example, basic science explanation for why dyspnea occurs specifically in asthma. This is where you'll see the fully integrated approach learned from Baghdadi, with science causal explanations woven in among the clinical findings in each feature description. As an added component, our scripts also include the basic science core concepts derived from the Aquifer Sciences curriculum that underlie each described causal mechanism. Core concepts are explicitly included in the clinical features and mechanism of disease map section of an integrated illness script, making explicit the important conceptual connections to the clinical observations and interwoven transdisciplinary causal mechanisms and foundational basic science knowledge. In this manner, the integrated illness script provides support for inductive clinical reasoning from the observed features back through the relevant causal mechanisms and basic science concepts to the originating insult. The implications for further workup and management sections are open notes fields to provide students an opportunity to reflect and record how this knowledge will influence their clinical practice in diagnosing and treating patients with this condition. Their work is visible in your reporting, as you'll see later on, and may be used as a classroom or clinical assignment. The accompanying mechanism of disease, or MOD map, is a unique type of linear concept map that provides an integrated basic science visual representation of the illness. Starting with the original insult, the MOD flows in a deductive, causal manner consistent with the way a basic scientist would explain the occurrence of a given clinical feature in a known disease. Each box is color-coded to the relevant core concepts, which are integrated on the side for easy reference. Taken together, the integrated illness script and the mechanism of disease map provide a holistic, cognitively integrated, and clinically relevant overview of conditions that may then be used broadly in clinical decision-making. You'll notice that in the sidebar, students can easily record notes, bookmark key content, and reference lab values as they work through the scripts. We ask that you do take the time to share any feedback on our scripts with us. It's easy to use the feedback session to let us know what you think. Integrated illness scripts are now included in our content library as well, which means you can search and filter to find what you need. You'll notice that scripts appear in the search right alongside our cases. For example, you can view all scripts available to you, or find the scripts that fit into your basic science or clinical courses. You can also search by system, presenting problem, or diagnosis, or use the free text field to find what you need. On each script, you get a quick view into the synopsis and mechanism of disease map. From here, it's easy to select scripts and cases to add to an Aquifer custom course. You'll see that integrated illness scripts are also visible in reporting alongside Aquifer cases. You can view completion status and see any notes students recorded in the implications for further workup and management sections. And in the educator resources section, you'll find great new tools to help you integrate our scripts, starting with our educator guide, which gives you a complete view of the scripts and MOD maps that are currently available. You'll also find content mapping guides, which give you a quick to scan visual list of which scripts apply to your course or clerkship, plus lists for each basic science discipline linking to our core concepts. One of the fastest and easiest ways to get started using scripts is to download our activity cards, located right here in your educator resources. As you'll see later in the presentation, they provide a range of simple and effective teaching strategies for your classroom or clinical rotation. And as you scroll down in the educator resources section, you'll also find our integrated learning sessions. They are completely developed learning activities ready to drop into your classroom with facilitator guides, handouts, and answer keys. You'll hear more about them later in the presentation. For more about how to use scripts in our learning platform, we have complete resources and a video guide to help you get started. And now I'm going to turn it over to my colleague.
Thank you. Integrated illness scripts bring a unified, comprehensive view of conditions that help break down silos. For basic science courses, scripts bring in the authentic clinical relevance that helps to organize and cement key scientific understanding, and explicitly showing the critical knowledge from each of the basic science disciplines to clinical practice. You all know that future clinicians really want you to answer, why does this matter to my future practice? Scripts help with that question. Recently, I was able to incorporate the clinical feature of wheezing into asthma into my first year course. The integrated illness script helps students not only recognize wheezing in a patient with asthma, but by understanding the basic science mechanism, hopefully they can apply this to other clinical presentations. Scripts provide a reference that drives home a deep understanding of why conditions occur, refreshing basic science knowledge in a timely and relevant way to inform clinical decisions. And you know, having a deeper understanding of why a disease is happening is invaluable when they come face to face with a complex patient or a set of symptoms. It makes them better problem solvers, which every student wants to be and every patient deserves. For faculty, scripts deliver access to trusted expertise beyond your specialty. Scripts provide the full view of a condition, integrating knowledge from across the curriculum and the disciplines. Because they were developed and reviewed by teams of experts from each relevant discipline, from anatomy and physiology to pediatrics and internal medicine, scripts allow any faculty member to provide the comprehensive teaching on key conditions to students, setting the stage for developing lifelong expertise in both learners and faculty. Integrated illness scripts are intended to be used broadly throughout the medical and health professions education. They can be used by learners at all levels and have been found to be invaluable by faculty and clinicians. There are applications at all stages and locations for learning, from a physiology classroom to the bedside, as a study guide or quick reference on the wards. I've used the clinical feature of dyspnea from the cardiogenic shock script to allow students to transfer this basic science mechanism to other clinical disorders that I present, such as mitral valve stenosis and asthma. These scripts can be added to the curriculum or dropped into your course at any stage to deliver clinical context, drive clinical decisions, or deepen understanding of key conditions. We're all short on time, and figuring out how to use new resources can be daunting. To make it as easy as possible for you to integrate this new tool into your curriculum or course, we've developed teaching tools that are ready to drop into your clerkship or course. Our evidence-based activities are available to accompany integrated illness scripts. Activities range from 5 minutes to 30 and fit in a variety of learning settings, activity types, and learning goals. For example, our team has developed a series of clinically relevant active learning exercises to accompany our scripts, ready to drop into your course. The series of activities based in trusted learning theory extend the learning to help students recall and apply their knowledge. These activities are a perfect way to get started. They are fully developed, many with handouts included, to use in your basic science course or enhance learning on the wards. They are short and sweet, ranging from 5 minutes to 30 minutes to fit your needs and time available. Each activity requires you to assign the script or group of related scripts to students as pre-work. So the students will review the script and the mechanism of disease map in advance and come in prepared to build on that knowledge. For example, kickstart a conversation or group activity about how best to explain to a patient how a condition occurs after they study the script and mechanism of disease map. Perfect for your rounds or your classroom. Or compare and contrast similar conditions in class using our handout template. This activity could easily be combined with a case to work toward a diagnosis or management decision driven by understanding the basic science concepts of each condition. Several activities include a mechanism of disease map handout. Some students can fill in just the clinical features or underlying pathophysiological insult, or complete the whole map. These are available for each script. This allows learners to recall and trace the disease process and leaves them with a useful takeaway study tool. If you're looking for a more comprehensive classroom session, we also have fully developed case-based integrated learning sessions on several conditions. These complete packages with facilitator guides, handouts, and answer keys can be run in 60 or 90-minute didactic sessions. The packet includes a case vignette, a compare and contrast activity, and a clinical decision, ideal for the busy faculty member or resident that needs to facilitate a didactic on clinical decision-making that's related to common presentations. These classroom sessions are great because they have a complete step-by-step instruction guide and even include an answer key. To take advantage of these teaching tools, you'll need to sign into your Aquifer account, then click on the teal Educator Resources banner. From there, you'll see the Sciences Integrated Illness Script resources, which also include an educator guide, content mapping guides, along with the activity cards and case-based integrated learning sessions. We hope these tools will give you a jumpstart to discovering meaningful ways to integrate scripts into your teaching.
So now that we have a handle on the who, the what, and where, let's talk about the how. Because scripts are such a versatile tool, there's a broad range of ways to put them to work. Whether you're adding a short activity to your course, quick discussion on rounds, or undergoing a major curriculum reform, I'd like to suggest a few strategies to help you get started and share with you what's worked for myself and my colleagues at Loma Linda University. At Loma Linda, integrated illness scripts have become a key foundational tool in our new Discovery curriculum. When we were undergoing a curricular redesign, we really wanted students to build the skills of deconstructing, analyzing, and reconstructing their own conceptual understanding. We found integrated illness scripts to be an ideal tool because the format facilitates learner-level cognitive integration. It's the only tool we know of to do this, and it easily spans diverse learning environments by providing consistency throughout the different stages of education and learning. We will explore what we've done at each stage in more detail later, but at a high level, we have students create scripts and mechanism of disease maps in the first year. In year 2, we start to apply them in problem-based learning sessions. During clerkships, some faculty have adopted scripts in a range of ways, including case-based learning, building assessments, justifying clinical decisions on the wards, or incorporating them into morning reports and case discussions. In the 4th year, we have a senior selective course where students invest time building scripts and maps for advanced conditions directed towards their future specialty, thus creating their own resource library. With this approach, the complexity and application for students can increase as they advance. I think one of the reasons this approach worked for us was that the students had a deep introduction to the integrated illness script format. By building on their own and using them in problem-based learning sessions, they get to know and understand the value of this tool. This made scripts a valuable resource to help students frame their future learning and development of clinical reasoning. What we have observed early in our new curriculum is that by building integrated illness scripts into our PBL curriculum, students have become much more proficient in their process of clinical reasoning and discussions compared to students in our legacy curriculum. Although we found the scripts to be transformative across our curriculum, you don't need full curricular integration to get started and make an impact for your students. With integrated illness scripts and the activity cards, it's easy to start small in a single course or lecture. At the pre-clerkship stage, whether you're teaching a basic science course, an organ system-based course, we find that the scripts provide a way to link what you're teaching to clinical practice. By making clinical connections, you're making it easier for students to understand why they need to know these things, which of course helps the information stick. And as we know, students are hungry for clinical learning at this stage. Scripts allow you to add clinical flavor to your lecture or course without needing support from clinicians or other faculty, which we all know can be hard to find. At Loma Linda, we have our students start off by working in teams to build their own integrated illness scripts. This challenges the students to form a complete understanding of conditions and gives faculty the opportunity to see cognitive integration in action by reviewing their work, and the students the benefit of having feedback as they develop. Later on, we revisit concepts from the same scripts students develop in PBL sessions to begin asking students to make and explain differential diagnosis and management decisions. Faculty are doing this in a variety of ways, but one of the most common is giving individual students or team of students an undifferentiated patient and asking them to develop a differential diagnosis, create a plan for testing or treatment, and predicting the patient outcomes without treatment. Students use the scripts and maps to compare and contrast and diagnose and explain their rationale. Learning can be extended by discussing what if to explore variations on the case. I would also add that integrated illness scripts are a great reference tool for faculty to prep for lectures. Because they are concise and cover all of the relevant disciplines, It's sufficient to cover what you need to know before teaching. And remember to take advantage of the activity cards for quick and easy solutions. Two types of activities I would recommend at this level are the compare and contrast, which come with handout templates and filling in the MOD maps. And for fully formed lectures that combine many of the elements I've described, take a look at our case-based integrated learning sessions. As students enter their clinical phase, we find integrated illness scripts helpful as students are asked to go further in making, explaining, and justifying diagnosis and management decisions based on causal mechanisms and explain why conditions occur. By using the scripts in both pre-clerkship and clinical courses, you give students a consistent tool as they transition to the clinic. We know this transition can be challenging for many students, and having a trusted mental model to scaffold their knowledge as they begin seeing patients and making clinical decisions is so valuable. Again, some of our faculty have implemented a range of learning activities around the scripts at this stage. We build on what was done in earlier learning by holding more advanced case-based learning sessions. Working with scripts challenges students to link their knowledge of basic science concepts to the clinical problems in front of them. Forming these connections helps them begin to solve problems in a meaningful way. We also assess students on the knowledge gained in scripts through synthesis essay questions, challenging students to justify your choice of decision X using an integrated basic and clinical science explanation. This gives us an excellent view into the minds of students to see how their reasoning skills are progressing. We also assign students or team of students a different clinical feature from the disease we're focusing on to research and synthesize the causal mechanisms. And just like in the preclinical setting, you can adapt scripts to fit your needs. You could easily assign them as pre-work for a lecture and perhaps incorporate ideas from our activity cards, like using the simple compare and contrast matrix with similar conditions, or building an analogy to help with patient communication to easily create a session to fit your curriculum. It all comes together at the bedside. This is where students truly put their knowledge into practice on clinical rotations. While almost all faculty want to connect basic science into their clinical teaching during hospital rounds or clinic discussions, most don't have the many hours of time to do the background research needed to prepare for discussing the basic sciences. This is where integrated illness scripts and maps become an invaluable resource for faculty. Countless hours of work have been distilled into minutes of reading. Armed with integrated illness scripts, some faculty at Loma Linda incorporate them into daily teaching, challenging students to explain or justify management decisions based on the underlying basic science. Including this content and referring to scripts as a reference keeps this information fresh in their minds to help inform clinical decisions. Cards provide handy discussion prompts, great for incorporating into discussions or bringing up during downtime in a clinic. Another simple way to bring the scripts into your teaching is to assign them as self-directed learning. If you're already using Aquifer cases for your clerkship or course, you can easily incorporate scripts into that assignment to make them available as reference or study material for your students. Integrated illness scripts can combine with Aquifer cases to build a custom course in the Aquifer platform. Encouraging students to assess the scripts as a reference or study guide gives them a trusted primary source with added benefits of this integrated approach. Integrated illness scripts and the conceptual understanding they drive are ideal for improving patient communication. For example, ask a student to review a script relevant to a patient that they are seeing in clinic. Then use an activity card prompt to prep for explaining to the patient how and why the condition occurs, or build an analogy to help the explanation based on the basic science mechanisms that underlie the condition. We know it can seem like a big challenge to integrate new tools into your curriculum, but I can tell you it's incredibly rewarding to see students making these connections and applying their cognitive integration frameworks to patient care. We want you to know we're here to help. And now I'll hand it over to my colleagues for our Q&A session.
Hi, Dave. Hi, Robin.
Hi.
All right, here we go. I didn't see a single question in the Q&A while this was going on. All right, so let's see what we can get started with. Dave and Robin, would you like to just quickly introduce yourselves for me?
Sure.
Sure, ladies first, Robin.
I'm Robin English. I'm the Assistant Dean for Undergraduate Medical Education at LSU School of New Orleans and School of Medicine in New Orleans. I'm a pediatric hospitalist for my clinical practice, but I spend most of my time overseeing the preclinical curriculum. So lots of basic science.
And I'm David Harris. I'm at the University of Central Florida. I'm a physiologist and I lead our structure and function module, anatomy and physiology. So early on in the first year, you know, this is month 3 or 4 is where I first get introduced to the students.
Excellent. All right, so we have a little bit of time for our Q&A. Let's start with this one that came through in the registrations. How could you use integrated illness scripts for remediation? Who wants to take that one?
I can take that. I think the remediation part is, it could happen in pre-clerkship or clerkship part. And I think that having a student review the illness scripts or the MOD maps and be able to explain it to an instructor, to a professor would be, I think, illuminating in terms of how much they actually understand. How can they compare and contrast between the different entities, the different diseases? So pneumothorax, pneumonia, asthma, for example. So if I had a student who I thought was maybe struggling with understanding the differences there, I could ask them to review the illness scripts, review the MOD maps, or review the illness scripts, write the MOD maps, and then discuss it with a faculty member to see if they seem to get it. I would, you know, if there are other specific questions about remediation, maybe I could respond to that too.
Okay, Dave, did you have anything to add to that?
No, I mean, I had just thinking of this as Robin said that. I thought of a student today that, in all honesty, she's a struggling student. She's repeating a year, and she's had medical issues. She's had flu. She's had COVID, and you know, I was actually just contacting her earlier today and trying to say, what can I do to get you back? She's missed all her TBLs, her group sessions. And now, as Robin was saying, these could be, you know, some of the illness scripts selected for the ones I use in my class could be a way that I could at least get her try to catch up on some of these things to kind of consolidate material into one. So I actually just came up with that idea as Robin was speaking. So,
well, I mean, I think a conversation between you and the student of let's think about these 3 diagnoses and how are they different? And how are they different from a basic science standpoint? And then how does that also, you know, reflect in how their clinical presentation is? I think, you know, having it as an open, you know, we all in medical school, we hate the oral exams, but that tells you what you know, right?
Absolutely. All right, great. So while you guys were answering that question, Kirsten asked a question in the Q&A that Carrie was able to answer for us. So in discussing the activity cards, she asked if there was an electronic format or an app. So she has a physical deck of cards that I think she received from our Wellspring package, but she said it would be easier to share if available in all formats. So Carrie answered that they are if you have access to the integrated illness scripts and that they are in your Aquifer account. So if that's something people are interested in, I just wanted to point that out. Kirsten also said, I would love to hear more examples of how people are using the activity cards.
I have some examples of how you might, but I'm going to leave it maybe to the group if people are using it.
Yeah, that would be great if anybody wanted to put anything into the chat, or if anybody wants to raise their hand and we'll promote you to a panelist, that's totally fine as well. Robin, you had mentioned that you were looking at some of them earlier.
Yeah, I mean, I can get things started. I think one of my favorites is the clinical communication. It's a 5 to 10 minute. I love the idea. I'm a hospitalist, so I see sick kids every day. And it's important to me that my parents, my patients know what's happening with them with respect to their disease. And so I think if you were able to have a student look at an illness script or a mechanism of disease map and be able to explain it to a parent or a family member or a patient, this is how this works. This is what happened to your body, as they described earlier, perfectly healthy body, and then this happened. To be able to do that, I think is a really important gift for doctors. So for example, this particular, it's called clinical communication. The student has been diagnosed with this. They're curious about what causes the disease. Ask the student to write in response to the following prompt. How would you communicate the epidemiology and causal mechanisms? I think this is a very easy 5 to 10 minute exercise that your students can do to use the scripts and really translate it to their patient's health. So that's one example. I have others, but there's my one example.
All right.
I'd love to hear feedback from the person who asked that question. I mean, this is a skill that we have to teach our students, how to talk to our patients. And using the scripts, using the science, I think is an important part of that.
I was going to say, Megan, I have another one, and the scripts, I think they just came out in the fall, basically, if I remember right. So my course is going full steam now. But one of the ones that pop up to me, it's something called exam questions. Students are always, especially early on, are asking, for more questions. How do I get practice questions, Dr. Harris? And one of the cards, it's a 10 to 20 minute card, but basically have the students, as they look at, you could give them a couple scripts, maybe a type 1, type 2 diabetes, and have them design exam questions based on that. I think the card basically says you can use an open-ended question and or a multiple choice. So I think it gives students another way to visualize it. And I think, how, like Robin was saying as well, I think that also will lead them to start to compare and contrast some of the items, what differentiates a type 1 from a type 2, which the scripts will help them, but them actually making an exam question could lead to that as well.
Excellent.
Another thing that I would add to that is the harm statement. And I think having students think about what harm could potentially come to their patients if they don't understand the science behind the disease, I think is really important. There is a card. It's a 10 to 20 minute card. It's part of, it's been part of the Aquifer Sciences project from the beginning. Is what harm comes to your patient if you don't understand this. And that could be pharmacology. It could be just any general therapy. And thinking of ways that you might bring this into clinical rounds. If you are lucky enough to have a Pharm D, on rounds with you, use that and use these cards as a possible way, or have the students think about a possible way that having not knowing the science behind it could really affect the pharmacology of the way you treat a patient.
And I put the link in the chat for the Aquifer Sciences database, which, as Robin was saying, when we, it's a database of integrated learning objectives that is available to you. And there's a harm statement with each one with the teaching point. So even if you wanted to use it for faculty development to help with that, it's there in that, you know, so even look at that website and there's a lot of information on there as well.
Perfect. All right, we have a question that also came through on the registration form. How can the integrated illness scripts be used to prepare for the OSCEs?
So I can take that, Megan. So I think, you know, a lot of it depends on what your aim is to get out. What's your goal of the OSCE? I think, you know, Robin's all, you know, mentioned patient communication comes to my mind quickly. You know, there's you know, the scripts can help, you know, these are written sort of scientifically, but that skill to translate from, you know, the mechanism of disease actually to a patient communication, I think is key. So if that's the goal of that OSCE station, I think that's one way. You know, I think, you know, asking, you know, to justify differential diagnosis, or, you know, what's the next step in workup? What tests do you need to order? You know, and it's, you know, a lot of it's based on the basic science underlying mechanism as you look more and more at these scripts. You know, the type 1, type 2 diabetes, whether you're going to order an antibody, I mean, there's many things, but I think that's some of the things, depends on the goal of your OSCE, but absolutely, I think is very relevant for, you know, management, diagnosis, or even patient communication.
Yeah, I mean, another thing, Dave, too, is just what physical exam findings are you looking for? Are you looking for lung crackles? Are you looking for hyperresonance? Are you looking for, you know, what are the physical exam findings that you're looking for? That's part of the clinical features that are in the illness scripts. And it's so, yeah, I agree with Dave completely. It's all about what your objectives are, but it's not, I mean, there are different things that you can look at with an OSCE.
Okay. I haven't seen any more questions come in through the Q&A or anybody raise their hand. So we're going to wrap it up. All right. Okay, so Dave put the website in the chat, and Matt did as well. Carrie's been providing some information as well on resources. So we have lots of ways that you can get up to speed with the integrated illness scripts. We have a white paper. We have a podcast that's out. We have multiple blogs, and you will be able to go back and review this webinar in the next 48 hours or so. So you can find more information regarding the integrated illness scripts on our website. And finally, we want to share with you, some of you have had questions about the activity cards, and this would be a really great web shop for you. We have an upcoming web shop, which is a workshop gone virtual. We do small group hands-on work with active discussions. It's rich faculty development opportunity with a high level of participation and participant engagement required. So this upcoming web shop will explore simple ways to support your students in deepening their understanding of why key conditions occur using ready-made tools from Aquifer. So this web shop is coming up on February 15th at 3 o'clock Eastern time. And so if you're interested, we will drop the link in the chat for you as well. And we are happy to answer any questions also that you might end up having. So I would like to thank all of you for attending today, and look forward to a copy of this webinar and also a survey from us as well. Thank you, Robin and Dave, for your time. We very much appreciate it. And we hope you all have a great afternoon.